Hello, everyone. My name is Samuel Sohnly, and I am here to present my capstone thesis on reducing opioid drug abuse in Ohio communities. I want to take a minute and just really thank you all so much for being here. Your support honestly means so much to me. I want to give a special thank you to a few people. Sean Johnson, who provided immense support as my counselor through this project. To my lovely wife, who has heard this presentation 30 times and still showed up again to listen. To my awesome boss, Kate Wright, for giving me professional guidance and time away from work to focus on this project. And my stellar professor, Michael Williams, and Pranav, the executive director of the C.A.R.E initiative, for informing this project, leading the wonderful work of his nonprofit, and for being here tonight. Quickly, before we get started, this can be a dark and emotional topic. If you need to jump off at any time, I will take no offense. According to the CDC, in 2021, the United States suffered the loss of over 100,000 people from fatal drug overdose, a record high in this nation's history, up 28.5% from 2020. According to the Columbus Foundation, a large majority of Americans understand that we are in the midst of an opiate crisis. However, less than 20% believe the risk threatens their family. But the effects of this issue are wide-reaching. When we hear about someone overdosing, we might have an idea in our head about what that person's story is. However, we're often incorrect. Birdie Light is an organization dedicated to reducing drug abuse. They were started by Eli's loving family in this picture. Eli was 20 years old, a sophomore in college. On their website, they say he was quick to smile, quick to hug his siblings, and quick to adapt to new situations and friends. He often drew a crowd. He was on his way to a meaningful life of love and connection. Eli died from fentanyl, a synthetic opioid that in Ohio was responsible for nearly 80% of the unintentional overdose deaths in 2020. It's often unknowingly mixed in with other drugs like cocaine, heroin, and counterfeit prescriptions. Individuals typically never know that they are exposed until it's too late. There are so many stories: innocent children, wives, husbands, high-achieving students who get into their parents' prescriptions or are prescribed opioids for a sports injury and become addicted and head down that path of suffering. Here's a short clip from Brenda.
We were driving to the supermarket, and as we entered the parking lot, a car ran a stop sign and completely T-boned us. When I was first prescribed my prescription pain meds, there was nobody to tell me that these have a really high potential for addiction. How can I be addicted and get these from my doctor? It kills your soul and it makes you feel worthless.
Like Brenda, Stevie Ray in the bottom left survived a car accident and was prescribed opioids. She became addicted, and when the doctor stopped prescribing her, she began illegally purchasing and eventually turned to heroin. In fact, around 80% of heroin users reported misusing prescription opioids before switching to heroin. Judy's son, a Dean's List college student and financial advisor, died from opioids. Britton served our country in the Army, where he suffered a severe injury. He was prescribed opioids at 19 years old and became addicted. This epidemic is indiscriminate. It affects everyone at almost equal rates: poor, rich, cities and countryside, black and white. And arguably the worst part of it all is that despite valiant efforts, time, and resources, the drug abuse problem in Ohio continues to rise. In recent years, Ohio has been one of the hardest hit states. In 2020, we had the 4th highest drug overdose death rate in the country. The number was larger than deaths from suicide, car crashes, and homicide combined in 2015 for those under the age of 55. According to the Ohio Department of Health, this similar trend has continued through at least 2019. In 2020 in Franklin County alone, 855 of our neighbors died, making it the highest county in the state for overdose deaths. This graph demonstrates how overdose mortality across the country continue to rise and how Ohio and Franklin County are far above the national average. Luckily, there are a number of wonderful and hardworking organizations who are acting locally to battle this epidemic. For those unfamiliar, the C.A.R.E initiative, for example, provides fentanyl test strips and hosts a deadly batch alert system to help reduce the number of people exposed to deadly agents. In fact, just this morning, today, I got an alert on my phone from them that counterfeit Adderall was being sold near Ohio State's campus, filled with fentanyl. The organizations on this slide are just a handful of groups who are tirelessly providing and supporting programs and initiatives within Franklin County. How do we solve this problem? I say one community at a time. Introducing the C.A.R.E Alliance, my recommendation for that community impact. I propose that the C.A.R.E initiative, in addition to their current efforts, dedicate a team to coordinate what will be the C.A.R.E Alliance in the Hilltop and Franklinton communities, which contain some of the highest zip codes for deaths within Franklin County, Ohio. By fostering community alliance, we connect actions, resources, and education to reduce suffering from the opioid crisis. This alliance or coalition gathers community leaders, businesses, nonprofits, really anyone who has an established relationship within the area and connects them with the professionals, organizations, and programs already dedicated to the opioid crisis. Currently, many of the substance abuse reduction organizations in the area have segmented efforts. One goal of this alliance is to bring in all the scattered resources and create one central hub between them and the communities that they are desperately trying to reach. Community alliance partners will have access to a myriad of evidence-based tactics, ways, and opportunities to be involved with the vision of communities working together free from opioid drug abuse. This is a generalization of how the C.A.R.E Alliance works. The Alliance acts as a bridge to create more community access points through established and trusted relationships. On the left, we see those dedicated national, state, and local organizations who can provide funding, resources, advocacy, training, and more to Alliance partners. And on the right is a very short list of some key community organizations, including local area commissions, clubs, schools, hospitals, and both for and not-for-profit organizations who can act as that trusted bridge between local communities and the help that they need. It's important that there are options for all types of partners based on capacity and preference. The C.A.R.E Alliance will consolidate all the important resources available into a menu for partners to select from. In the previous slides, you may have seen some potential partners listed that maybe didn't make the most sense, but everyone has a part to play. SAMHSA is one of the leading nationwide organizations on this topic, and they shared some eye-opening stories. Veterinarians, for example, they should be prepared for and trained to deal with individuals who intentionally injure their pets in order to get access to prescription painkillers. Funeral homes have a part to play. Families with loved ones who have passed on may need to dispose of that individual's prescription medications from their home. A funeral director could help educate on how to do that and provide a location for safety disposal boxes for grieving families. Real estate agents are important too. There are cases of abusers attending open houses and stealing people's prescriptions from their homes. Homeowners should be informed to safely store those medications. These are just a few examples of how the Alliance can build simple but valuable access points from community partnerships. So here's why it works. The Alcohol, Drug, and Mental Health Board of Franklin County, ADAMH, plans, funds, and evaluates behavioral healthcare services in our community. In 2020, they conducted a community needs assessment for mental health and addiction services across the county. Surveyed social service providers said they felt overwhelmed by the volume of information about available services. And conversely, another large group said they couldn't find or did not hear about relevant information at all. Additionally, 79% of the population surveyed needed at least one prevention service. And of those individuals, only 49% reported being unable, 49% of them reported being unable to receive that service that they needed. Over 60% of surveyed Franklin County residents indicated needing just general information about behavioral health prevention services. This survey is valuable evidence to how a community coalition can make a real impact. Now, focusing on Franklinton and Hilltop might seem too small, but according to an article from the American Journal for Public Health, there's evidence that fewer, more focused, managed relationships, or lower density, are more effective at implementing evidence-based prevention programs. The Community Anti-Drug Coalitions of America, CADCA, is dedicated to community alliance work and present the real-world evidence of their effectiveness. They use strategies from the CDC, SAMHSA, and other evidence-backed research to provide the proven framework that C.A.R.E is based on, including the 7 strategies for creating effective community change and the strategic prevention framework. All of the menu items focus on these 7 strategies. The CDC supports coalitions through the Drug-Free Communities Support Program. And this map shows the more than 700 community coalitions that received funding from the program in fiscal year 21. A 2019 national evaluation found that these drug-free community coalitions were 1, successful in building local capacity, 2, had a positive impact on their communities, including increased involvement and more positive climates in schools, and 3, saw a significant decline in substance abuse for youth across multiple substances. As you can see here, there are no drug-free community coalitions being funded in Franklin County. The closest is in Circleville, 40 minutes away, and they're in their inaugural first year. Youth are a big target for coalition programs and a great indicator for successful abuse prevention efforts. From 2002 to 2020, across those drug-free coalition target areas, there was a significant decrease in the number of middle and high school students who reported using substances in the past 30 days, including a 26% decrease of high school students misusing prescription drugs. In CADCA's 2019 annual survey of coalitions, they saw drastic positive impacts across multiple areas. There was an increase in access to information and a 48% increase in access to treatment. So here's how we do it. A program coordinator would manage and lead the C.A.R.E Alliance. They would be responsible for the creation and maintenance of the resource and program menu, onboarding and managing alliance members, securing funding, working closely with source leadership, and managing volunteers. And here's a visual timeline of just some of the key milestones as the Alliance moves toward impact and growth. In reality, this Alliance could be implemented by a number of different organizations or potentially even individuals. So why C.A.R.E? Because they have a great foundation of established relationships and with community and organizations, a team of devoted staff who are knowledgeable and passionate about this issue. And it would be a great opportunity for C.A.R.E to grow and promote current programs to a wider audience. For implementation, C.A.R.E would be responsible for dedicating that program coordinator, having regular meetings with that coordinator and upper management to provide accountability and guidance, and covering the first year of funding for the program until they're self-sustained. Now, there are a few possible options concerning cost. This chart shows the recommended initial budget for the C.A.R.E Alliance. There are additional recommended structures and a deeper explanation of these numbers on the full report, which will be sent out post-presentation. Although it's important that a dedicated full-time staff member act as the coordinator due to the level of commitment, in the inaugural year, it may be possible to find a volunteer to fill that position and forego a salary and reduce that financial obligation on C.A.R.E. This would allow the program to be started with very little financial investment and for funding to be secured for a salaried staff member in the following years. C.A.R.E's current budget would be responsible for the estimated $2,121.50 to be dedicated for the creation and first year funding of the C.A.R.E Alliance. There are a number of grants available for opioid organizations, and many specifically just for coalitions like C.A.R.E. C.A.R.E currently receives some funding from sources like the Columbus Public Health and State Opioid Response, and implementing this program could open the opportunity to receive additional funds from a wider range of grants. During this presentation, we've spoken to many key benefits, But in conclusion, this initiative has the potential to drastically increase efficiency of program delivery and effectiveness of lasting impact. Like any program, there are a number of potential obstacles to overcome. Pushback from the community, time commitments, funding, and other unintended consequences. However, with proper preparation, the variety of resources available, and dedicated, mindful, and persistent staff,
Good evening, everyone. My name
I'm
is Peter,
confident
the
that
service
this
manager.
alliance will be successful. Of course, it's very important to evaluate the true effectiveness of the alliance efforts. So there are a number of key data points that can provide this insight, including the total number of events and attendees that are hosted, the satisfaction survey results, data like the numbers of overdose deaths in our neighborhoods, and more. Currently, there is no adequate community coalition or alliance in the Hilltop or Franklinton neighborhoods. This solution is a direct answer to the needs discovered in the Adam H. Community Survey. The groundwork has been done. The need is real. The method is proven, and the resources and allies are available. Following this presentation, I am urging the C.A.R.E initiative to dive deeper and analyze my complete report. Discuss with your team about if this is feasible, and strongly consider taking the leap and implementing this alliance in the near future. Our communities need it. For everyone here, I ask that you take individual action. Learn how to properly store prescriptions. Talk with your family and children about the dangers of opioids. And consider supporting local organizations like the C.A.R.E initiative. We need to raise the alarm and get all hands on deck if we hope to make an impact on this relentless and growing issue. Concentrated community efforts can be that crucial missing piece. I want to sincerely thank you all again for joining this presentation. I will be sending out this recording along with my final report and a resource sheet. And now, if there are any questions, I would be happy to discuss. Thank you. Thank you all very much. I really appreciate you all coming out and on Cinco de Mayo nonetheless, and making time to listen to this. I'm very passionate about this this issue, if you didn't pick up on that, and I'm always happy to talk more about it on another time. But thank you all for coming. If there's no questions, feel free to jump off, and I'll stick around for a little while longer.
Sam, I think you did an excellent job.
Thank you. I appreciate that.
This is really dear to me because I grew up in the Hilltop, so I know those issues are prevalent. So I'm very aware of this issue in the Hilltop and Franklinton area. I'm glad to see that this is a passion of yours, and that I hope that the recommendations are taken seriously, and that, you know, it's moved forward and championed. I really like how you talk about the C.A.R.E Alliance and communities working together, and the collaboration of community agencies to provide resources to the community residents. So way to go. I know that I will see you somewhere, you know, leading this cause. And again, this was excellent.
Thank you, Saeed. I really appreciate those kind words, and congratulations on your graduation as well. It's exciting stuff.
Thank you.
Samuel. Hey, excellent job. I have a couple organizations I'd like to send this to, so make sure you send me the information so I can pass it on.
Will do. Thank you. I appreciate that.
Hey,
Awesome.
Sam, we have a question.
Yeah.
You mentioned this was better working in smaller communities or lower density areas. Is that scalable then to other communities of that size?
Yeah, that's kind of the plan to once, we can prove success on a neighborhood scale, to then just be able to replicate that design across other communities in need, which are most. So being able to successfully do that in Franklinton and Hilltop and take the lessons learned and the structure and be able to duplicate that across the nation would be amazing.
I love it. Awesome. Thank you. Great job.
Thanks. Cool. All right, everyone. Well, enjoy your Thursday.
Daniel,
Oh,
it's Drian. I just wanted to jump in and wanted to congratulate you. This was a phenomenal presentation. I'm so glad that I had the opportunity to listen in. I'm looking forward to the shared recording. And just thank you so much for just continuing to bring attention to the community needs. You can definitely hear your passion. And when we talked, I can sense it, I can hear it, I can see it, I feel it. And so just thank you so much. I'm sure that our paths will continue to cross, and let me know if I can do anything to continue to help your effort.
that
But
was very
congratulations.
kind. Thank you so much, Drian. And yes, I really feel the same way and really enjoyed our conversation, and appreciate all the work that you continue to do as well. And I'll definitely be reaching out in the near future to continue some conversations with you.
Wonderful. Thank you.
Thank you, Samuel. Great job.
Thanks, Chuck. All right. Good night, everybody. Thanks so much, and enjoy your Thursday and have a good weekend.
Night.
Good night.